everyone, Dr. Jeff here with you again today. Today I thought we'd talk about something called thoracic outlet syndrome. So you ever had pain or tingling and numbness going down your whole arm? Your arm feels heavy or feels weak, or it might be turning blue. You feel circulation issues. That could be something called thoracic outlet syndrome. Carpal tunnel syndrome is just when your hand, your three fingers, and your thumb get some tingling and numbness, especially at night. But this is your whole arm. And what can happen with that is that in your neck you have a whole bunch of nerves here, and they come out of your neck, and they're called the brachial plexus. So they kind of get out, they get themselves organized in order to go down your arm. And what can happen is these nerves will start to get pinched, and they'll kind of give you your tingling, your numbness, and some pain going down your arm. Whereas if your arm's feeling weak, or feel the circulation in your area feels cold, that could be more the artery that's coming with the nerves down your arm. This can happen for a number of reasons. One reason is you might have a cervical rib, which is a rib that comes off the bottom cervical vertebrae, and you're born with this. And that can be impinging on the brachial plexus. The other thing that happens is that first rib may become elevated, and that can pinch on the brachial plexus as well. That can come from coughing or sneezing or doing lots of overhead work with it. You also have muscles here, the pec minor, the pec major, the anterior scalenes, the middle scalene muscles that form a triangle around that brachial plexus. If those muscles start to get tight, that can pinch off the nerve as well. And this can happen from trauma where, if you're playing football, you may tackle someone and they hit you in here, or you hit someone in here, doing a lot of overhead work. Number one cause comes from bad posture. So being on the computer, on your phone, your shoulders are rounded forward, your neck is forward. So these pec muscles become very tight. The scalene muscles are forward, they become very tight. That makes that triangle so much smaller that there's no room in there for the nerves to act. And what can happen is certain postures, or if it gets really bad, constantly you're going to have this tingling and numbness going down your arm. Or again, the arm can feel heavy. So what you need to do with this is, if you have a cervical rib, we need to refer that out because that may be something a surgeon may have to deal with. But for the first rib, we may have to do some adjustments or manipulations on it to get it back into place. If it's the muscles, we can do some ART or massage. If it's something else, we may have to do some cold laser therapy on it to try and heal the area up. But the biggest thing is try and prevent this from coming on. And the best way to do that is make sure that you have good posture. So make sure your work desk is set up properly so you're upright and working. Make sure when you're on your phone is up here, not down here. I know we talked before about getting a GPS sensor on your phone so that it only works when it's in a certain position. That can be very beneficial as well. But try and keep you in good posture. Doing lots of stretching of those pec muscles, gain the arms back. So the best thing to do is prevention. Once you do have it, there are things we do to get you better. But the whole idea is try and prevent this from coming on. So if you have any questions about thoracic outlet syndrome, you think you have it, you want to talk to me, you can always email me at jgolds@goldswellness.com. You can talk to me on Facebook. Best thing to do if you do think you have some thoracic outlet syndrome, is actually come and see me so we can have a look at it. Try and determine exactly what it is and the best course of action to get rid of it for you. I'm Dr. Jeff. I've got your back.